Hello all. Today I'll be sharing key takeaways from the Wellbeing in Schools Professional Development Seminar I recently attended. This brief presentation will include information on teacher and student wellbeing, mental health promotion, intervention frameworks, learning programs that focus on social and emotional wellbeing, strategies we can use in the classroom, and professional development recommendations on this incredibly important and increasingly more prevalent issue. The Australian Institute of Health and Welfare defines mental health as a state of well-being, which allows a person to have confidence in their own strengths and talents, cope with the stresses that occur in everyday life, and work productively toward their individual endeavours. Students who experience positive mental health and well-being feel a connection to their school community, have a favourable sense of identity and self-worth, exhibit pro-social behaviour, and strive to reach their full academic potential. Conversely, the absence of mental health and well-being can be caused by multiple disorders. A 2015 Australian report lists anxiety disorders, which include social phobias, separation anxiety, and obsessive-compulsive disorder, major depressive disorder, attention deficit hyperactivity disorder, and conduct disorder under the banner of mental disorders. Recent research has indicated that approximately 14% of children aged between 4 and 11 may experience a mental disorder in any given year, with ADHD and anxiety disorders most prevalent. Mental disorders can negatively impact children's home life, school performance and attendance, social functioning, and sense of self-worth. In the school setting, children with diagnosed mental disorders miss more days of school than their peers and achieve lower scores on standardized tests. Additionally, these students may struggle to establish and maintain social relationships with peers, leading to feelings of isolation and limited opportunities to learn the social skills necessary to forge quality relationships. The incidence of mental disorders is often influenced by economic, family, and geographic factors. For instance, a child's home environment may be a risk factor due to a recent separation, economic pressures, living in a remote area, or chronic illness of a family member. As a multicultural school with many students from refugee backgrounds, we must also be mindful of the impacts of trauma on our students' social and emotional well-being. Be mindful of our trauma-informed practice program, continue to build connections with our students, and look for signs of trauma. So what can we do? As educators, we are in a powerful position to improve our students' mental health and well-being by providing positive learning environments, developing supportive relationships, and teaching well-being practices such as resilience and self-regulation. Through school-wide promotion of mental health strategies, we can work together to improve mental health outcomes for our school students and community. Social emotional learning, or SEL, is an evidence-based, universal approach that fosters cognitive, behavioural, and affective competencies in children. The Australian Student Wellbeing Framework was developed to support schools to create positive learning environments within which students feel safe and connected, and have loving and trusting relationships with educators and peers, which in turn promotes greater engagement and improved outcomes in academic, emotional, social, and physical domains. There are 5 elements, 5 principles, and 5 examples of effective practice within the framework, which I will summarise here. Leadership recognises the importance of school leaders in implementing positive environments in schools, including developing school values, communicating priorities, developing policies and plans, and seeking students' views on well-being in the school community. Student voice is imperative as it ensures that students are active participants in the process of establishing a school well-being framework, allowing them agency over policies that affect them. Collaboration with students promotes the uptake of well-being approaches. Support relates to the connection between well-being and pro-social behaviour, and how this positively impacts on learning and teaching. A whole school tiered approach is required to support our students, families, and staff. Inclusion is especially important in our school of diverse learners. as this element emphasises positive and respectful relationships between the school and our community. Respect for diversity and the contributions of all stakeholders in creating school connectedness is important in this element. Partnerships refer to the collaborative partnerships that schools create with families and further community organisations that support student wellbeing. For instance, partnerships with cultural groups such as the local Aboriginal and Torres Strait Islander elders allow for reciprocal sharing of knowledge and strategies related to wellbeing. When implementing a social-emotional learning curriculum, it is prudent to follow the tiers of intervention strategy that we use for inclusion and behaviour support. Please note that I have used the terminology used by Queensland Education in their policy documents to be consistent with our context. Most students can take part in whole class, differentiated instruction in SEL techniques, especially if the instruction has been planned using the Universal Design for Learning framework, so that it is accessible for all students. Some students may not cope with Tier 1 interventions and need targeted support in small groups. Further, a small percentage of students will need intensive interventions on an individual basis, and we would seek planning assistance from outside resources, such as psychologists and occupational therapists. So what does SEL look like in the classroom? I will offer a strategy for early years, middle primary, and upper primary today, but I urge you to explore more opportunities in your context. In lower primary, SEL skills can be taught and practiced as children engage in imaginative play with their peers. For instance, children pretend to be a family and assume the roles of mother, father, and siblings, and negotiate, cooperate, and communicate as they play. To maximise SEL learning, we must allow children to direct the play, seek out teachable moments, create a classroom where students have positive relationships with their peers and educators, plan for play, and develop physical environments with multiple spaces that support play. The Student Wellbeing Hub has a multitude of age-appropriate, curriculum-aligned resources for educators on all 5 elements. For example, you can access Queensland Health Prepared resources for young children to help them deal with trauma stemming from experiencing a natural disaster or the COVID pandemic, which includes age-appropriate storybooks and games. The picture book on the slide are also available in different languages, like Birdie and the Drought, which is shown in Swahili. The resources could be used as part of classroom explicit teaching of wellbeing strategies. In upper primary, SEL can be taught and demonstrated through all 5 arts subjects. The arts provides learning across emotional, aesthetic, physical, and cognitive domains, and is therefore the perfect vehicle for SEL. Immersion in the arts assists students to develop self-awareness as they express themselves through the different art forms, practice a growth mindset as they make attempts, revise and improve their creations, and achieve self-efficacy as they build confidence. The Metropolitan Museum of Art provides a fabulous resource for integrating the arts into SEL, with one activity narrowing in on students' sense of identity through the creation of a self-portrait. Before we can focus on the well-being of our students, we must first look inward and care for ourselves. We know that teaching is highly stressful. Between the workload, accountability, and the challenges of planning for and teaching 25 diverse little humans, teachers often do not care for their own physical and mental health, and this leads to burnout and all too often the loss of another teacher from our profession. It is imperative that we take care of ourselves and our colleagues. A prominent strategy for assuring teacher wellbeing is the establishment of a working community where challenges and solutions are shared and a healthy work-life balance is promoted. For these communities of educators to be successful, there must be trust, open-ended communication, and a true sense of belonging among leaders, teachers, and support staff. So, is wellbeing really our responsibility? It is. The National Principles for Child Safe Organisation states that a child safe organisation puts children's safety and well-being at the centre of thought, values and actions. As educators, we vow to maintain the QCOT Code of Ethics for Teachers in Queensland, and the 7th value is care, requiring us to commit to student well-being. The Australian Professional Standards for Teachers includes Focus Area 4.4, Maintain Student Safety. which pertains to ensuring the well-being and safety of our students and implementing well-being programs. When evaluating our professional development needs, we must target APST 4.4. We have identified that teacher and student well-being and SEL are priorities. So the next step is to seek appropriate PD opportunities and use our knowledge to implement and maintain a wellbeing program in our school. We should all attend a range of formal and informal learning experiences, guided by professionals in the field of well-being in the educational context, to promote a shared understanding and language across the school. However, a one-day intensive course is not enough. We need to be supported to implement practices, reflect on efficacy, and problem-solve solutions in the long term. Thank you for listening. I hope that you feel fired up about increasing well-being in our school.